Hello everyone, my name is Sanela Kusani. I'm a qualified professional nurse currently doing my postgraduate diploma in nursing education at the University of Johannesburg. Welcome to my online lesson. In this video, we will be talking about the mental status examination. So before I commence with my lesson, I have a following few questions I'd like to ask you. What are the key components of a mental status examination? Can you describe what you would observe in a patient's appearance during an MSE? How would you assess a patient's speech during an MSE? What is the difference between mood and affect in the context of an MSE? How would you ask a patient about suicide and homicidal ideations? At the end of this video, you should be able to describe what is a mental status examination, identify the key components of the mental status examination, systematically assess a patient's mental state, demonstrate confidence, sensitivity, and professionalism in conducting a mental status examination in a clinical setting. The mental status examination, also known as the MSE, is a structured way of observing and describing a patient's current mental state. It helps healthcare professionals assess various aspects of a person's cognitive and emotional functioning. In this video, we will be breaking down the key components of a mental state examination using the acronym ASEPTIC with a double T. This will help you remember the critical areas to assess when evaluating a patient's mental state. A will be appearance, S will be speech, E will be broken down into two, which is mood and affect, and then P will be perception. T, the first T will be thought process, the second T will be thought content, and then the I will be insight and judgment, and then C will be cognition. Let's start with A for appearance. When assessing appearance, observe how the patient looks. You look at their clothing, their grooming, their overall hygiene, psychomotor activities. Basically, the presentation of a patient tells you a lot about how the patient is. This can give you insight into their self-care abilities, physical abilities, and possibly their mental state. For example, an unkempt appearance might suggest depression. Next is S for speech. Listen to how the patient speak. You assess if their speech is rapid or slow. Is it clear or slurred? You need to take note of the volume and rate of the speech when speaking to the patient. The way the patient speaks can provide important clues about their mood, their thought process, and even their neurological function. So speech is also a very vital component of the mental status examination. E is emotion, but remember, we're breaking down emotion into two aspects, mood and affect. Mood is what the patient tells you they are feeling, while affect is what you observe. Facial expression, how their face presents. It is crucial to see if these two align. For instance, a patient might say they are happy, but their face, their affect, might be flat or sad. This can be described as the mood is congruent or incongruent to the affect. So when a patient says, I'm feeling good, and they look extremely depressed, that should tell you something. P is for perception. Perception involves how the patient interprets and experiences sensory information from the environment. Here you will explore if the patient is experiencing hallucinations or any other perceptuatory disturbances. Ask direct questions like, do you hear or see things that others don't? Perceptual changes can be a sign of psychosis or other serious conditions. Example, a patient might be having auditory hallucinations whereby they hear things that are not being heard by others, visual hallucinations whereby they are seeing things which others don't see, olfactory hallucinations, this is when they smell things that do not really exist or others aren't smelling. Tactile hallucinations, this is when they're having abnormal sensations and feelings on their body. And then you also have gustatory hallucinations, them tasting, but then they have nothing in their mouth and the taste is abnormal. So basically, these are the sensory inputs, and then when they have hallucinations, it can indicate a very serious abnormality and could indicate psychosis. And then T, don't forget, T we broke it down into two: thought process and thought content. T covers both these aspects. So the thought process and the thought content tend to be a complicated part of the MSc and takes time for people to understand. So I'll try and break it down first. So what is thought process? Is about how a person's thoughts are organized and connected. The key points are the thoughts logical and coherent? Are the thoughts clear and make sense? So basically, when it's disorganized thoughts, their thoughts they are jumbled, and basically they are hard to follow. When a patient is having a normal thought process, a patient talks about their day in a way that is easy to understand and follow, and it's in clear order. But where they have disorganized thoughts, a patient starts talking about their day and suddenly jumps to an unrelated topic like their favorite food, making it hard for you to follow the conversation. So you're unable to link what they're talking about. Now, when you're talking about the thought content, we're speaking about what a person is thinking, the ideas and the beliefs in their mind. The key points in this part, we speak about the normal thought content. This is when the patient thoughts are based on reality and they make sense. Then we have abnormal thought content. This is when the patient has unrealistic and unusual beliefs. Simple examples. So one having normal thought content, a patient expresses worry about an upcoming exam, which is a realistic concern if they're a student. But then if you're having abnormal thought content, a patient believes they are famous. They're a famous celebrity, even though they aren't. This can be seen as a delusion. So when it comes to thought content, there are many different types of delusions that a patient can have. Grandiose delusion, pituitary delusion, it's a lot. So with practice and experience, you get to understand and know the different types of delusions a patient might have. Also under the thought content is an essential part of the content of thought content. It is assessing for suicidal and homicidal ideation. This means asking direct but sensitive questions like, have you had thoughts of harming yourself or others? It's crucial to explore the presence, frequency, and severity of these thoughts. If the patient has a plan or intent, this requires immediate attention and intervention. Either this patient needs to be admitted into a facility or this patient needs to be supervised and monitored 24 hours as they are high risk for themselves and those around them. For example, a patient may express feeling of hopelessness or state they have been thinking about suicide. Also, they might voice anger or resentment towards someone, potentially indicating a risk to harm others. So this patient is severely high risk and needs to be attended to as soon as possible. Now, moving on to insight and judgment. Insight and judgment are critical components in the evaluation of a patient's mental health, as they reflect the patient's understanding of their condition and their ability to make sound decisions. Insight refers to the patient's awareness and acknowledgement of their mental state health, right? Including their understanding of the nature, severity, and impact of their symptoms. It involves assessing whether the patient recognizes their condition and its implication on their lives. Whilst judgment, on the other hand, evaluates the patient's ability to make reasonable and appropriate decisions based on their current situation and circumstances. This includes their ability to weigh the consequences of their actions, solve problems, and make choices that reflect a rational assessment of their needs and risks. C refers to cognition. Cognition refers to the patient's overall mental functioning and their ability to think clearly, process information, and perform mental tasks. This includes assessing orientation, which means determining if the patient is aware of their time, place, and personal identity, which can be recorded as PPT, And then evaluating memory is also very essential, as it looks at both the short-term memory and the long-term memory. Basically, also you need to look at the attention span, or the ability to focus and maintain connection, in other critical components of the cognitive assessment. Remember the acronym ASEPTIC, with a double T, to guide you through each key area of the mental status examination, whereby you look at appearance, speech, emotion, perception, thought process, content, insight and judgment, and cognition. By systematically assessing these components, you can gather a comprehensive understanding of your patient's mental state. I encourage you to practice these assessments regularly to build your confidence with the skill. Please pause the video and answer the following questions. If you're having difficulty answering the questions, please reference back to the video, as all the answers are in the lesson. And thank you for watching this video on the mental status examination. If you found it helpful, be sure to practice these components in your clinical assessments, and don't hesitate to review this video whenever you need a quick refresher. Thank you.